on your LinkedIn, you call yourself Stem Cell Whisperer. How did that name came about?
Yeah, a patient did that and posted something on social media, and I kind of stuck, and it was cute, so we kept it. But because a lot of what we do now is not directly using stem cells, but we can help stimulate our own stem cell and cell activity in a more youthful way. Because it's a funny thing, when you look at regenerative medicine as a whole, our bodies know how to heal. They have the blueprint, they have the genetic code. It's just about reopening those genes to be called upon, the proteins to be made in the cell. And you think about a child, like a 3-year-old scrapes his knee on the sidewalk, and mom cleans it up, puts some Bactina on it, puts a Band-Aid on it, kisses him, sends him on his way, right? And then 3 days later in the bathtub, the Band-Aid comes off and the scab is almost completely healed. But, Oscar, you or even someone older like me, I banged my arm at the gym or something, and man, I got a bruise for 2 weeks. Like, wait, I'm the same 3-year-old from years ago that used to heal in 3 days. What happened? So, our cells need a reminding, and that's really what the biologics are doing. They're whispering to our stem cells to, hey, behave like a 3-year-old and heal real quick.
Which are the signals that I keep on listening, right?
Yes, exactly. This is signaling medicine. We should probably, in fact, you use the phrase or the abbreviation MSCs, which people used to think stands for mesenchymal stem cells. Well, some have advocated that it's medicinal signaling cells.
Yep.
Yeah, because you're absolutely right. This is about signaling. It's encouraging our body to behave in a certain way. Supplements do that. Epigenetic lifestyle changes do that too. Like if you do a 72-hour fast, or you use the hot sauna, or you exercise really hard, you're sending signals, internal signals. Well, the strategy is to also use some external signals to get to really juice it up and get it going. With it's sort of it's a hack, and that's kind of where the term biohacking fits
Yeah.
in.
Yeah. I had a conversation with a scientist a couple weeks ago, and I believe Arnold Kaplan was the one that that said about the signaling,
Yeah, I
something
think
like
that's
that.
right.
Yeah. Yeah. So yeah, I've been learning a lot by having conversations with physicians and scientists. So I'm catching up. I'm catching up. Okay.
And we learn from the questions you ask and the questions that patients ask. What do they
Interesting.
want to learn? What do they need to know? And sometimes we as clinicians have to go back and re-educate, right? Because what we learned in our residency and medical school was so highly influenced
Hmm.
by entities like big pharma, and was taught to us by people who are, you know, trained 30 to 50 years earlier. So what I learned as a spine surgeon wasn't very different than 2 generations earlier.
Hmm. That's kind of sad because
It is.
medicine changes fast. you know?
Well, it should, and
Oh.
hopefully we're tweaking it now where these conversations can lead to that. But residency training is very similar in terms of what they learn to do. At least spine surgery and neurosurgery. It's the same set of operations, the same emergencies. Yes, there's a little more knowledge here and there, but when I go to the annual meetings, which I stopped going to, they literally someone reporting on a 10-year history of some procedure. That same paper was reported 30 years ago. They just did it over again. So it's recycling the same stuff.